This is the mesentery with its contents. So while keeping in position, we have to remember that while recognizing, we have to recognize the jejunum and ilium by their lumen and the thickness of their wall. So the thickness of the width of the lumen of the jejunum, it is larger than the width of the ilium. Then the wall, if you consider the wall, then why we think the wall, this is thicker, and we can see, we will feel, while feeling, we will feel a number of folds, circular folds known as plica circulars, which are thickly set. But in case of the ilium, we will not feel that folds. Now the anatomical position. This is the mesentery with its content. The root of the mesentery extend from the duodenojejunal flexure, is duodenojejunal flexure 2.5 cm left of the median plane, slightly to the left of the lumbar 2 vertebra, to the iliacecal junction at the right sacroiliac joint. Jejunum occupies the upper left portion and the ilium occupies the lower right portion. Now, this is the root of the mesentery. These are the folds. So in the jejunum, we will see the peritoneal windows. See, peritoneal window as the fat will be less distributed. So these are the peritoneal window, we can see clearly. But in case of ilium, the fat, see, in case of ilium, the fat are evenly distributed, so there will be no peritoneal window. Yeah. While considering this, the blood vessels, okay. So arterial arcade, these are few in number, 1 or 2, and these are the long vasa recta. These are the long vasa recta in case of the jejunum. But in case of the ilium, we will see, we can find here that these vasa recta, these are smaller. Vasa recta are smaller, but the arterial arcade, it will be 3 or 4 layers. This mesentery, it is actually a peritoneal fold, fan-shaped peritoneal fold that will suspend the jejunum and ilium from the posterior abdominal wall. So it will consist one root or the attached border. This border will be attached to the posterior abdominal wall, and a free or intestinal border. This is the free or intestinal border which will encloses the jejunum and ilium. This enclosing part is the free border of the mesentery. So this root, which extends from this duodenojejunal flexure 2.5 cm left of the median plane, slightly to the left of lumbar 2 vertebra, to the iliacecal junction, which will be located at the right sacroiliac joint. And this intestine, and this is its total length, it is 15 cm long, and this free border, it is 20 feet long. So because of this arrangement, it will form a number of folds, like this number of folds, and provide great mobility to the jejunum and ilium.